If you're receiving Social Security benefits or planning to in the future, September 30th could change everything for you. While Congress debates the program's future, several major changes are already set in motion that will affect over 70 million Americans. In the next few minutes, I'm going to break down the three biggest Social Security changes happening right now, from the end of paper checks to rising Medicare costs that could eat up your entire benefit increase, plus the behind-the-scenes reforms that could determine whether Social Security survives for future generations. Welcome to Financial Area, where we break down complex financial news into actionable insights you can actually use. If this kind of content helps you stay ahead of important financial changes, hit that like button and subscribe for more updates that could impact your financial future. Let's start with the most immediate change that's happening in just a few months. On September 30th, Social Security will officially end paper checks for all recipients. This isn't just a small administrative change, it's a complete transformation of how the Social Security Administration operates. The shift to all digital payments is expected to save the program millions of dollars annually. Think about it, no more printing costs, no more postage, no more staff time spent processing and mailing paper checks. But more importantly, it reduces the risk of lost or stolen payments and speeds up delivery times. When your benefit is deposited electronically, there's no chance of it getting lost in the mail or stolen from your mailbox. This digital transformation is part of a much larger modernization effort at the Social Security Administration. They're trying to streamline every aspect of their operations, and eliminating paper checks is just the beginning. The agency has also introduced an AI-powered chatbot to handle routine inquiries, though the reception has been mixed. Some users love the convenience, while others find it frustrating when dealing with complex questions that the artificial intelligence just can't handle yet. But here's the reality check. This change is going to be particularly challenging for older Americans who aren't comfortable with technology. The Social Security Administration knows this and is providing support resources to help recipients navigate the new system. However, if you're still receiving paper checks, you need to act now. Contact the SSA immediately to set up direct deposit or get a Direct Express debit card. Don't wait until September 30th because that deadline is firm. Now, let's talk about something that's going to hit beneficiaries right in the wallet: the relationship between your cost of living adjustment and rising healthcare costs. For 2026, Social Security recipients can expect a modest increase of around 2.6% or 2.7%. On the surface, any increase sounds good, right? But here's where things get complicated. The cost of living adjustment, or COLA, is supposed to help your benefits keep pace with inflation. But there's a major problem brewing. While your Social Security benefits are going up by less than 3%, Medicare Part B premiums are jumping by more than 11%. That means the standard Part B premium will reach approximately $216.50 per month in 2026. Let me put this in perspective with real numbers. If you're receiving the average Social Security benefit of about $1,900 per month, a 2.7% increase gives you an extra $51. But if your Medicare premium goes up by $21 per month, you're only seeing a net increase of about $30. And that's before we factor in any other rising costs like Medicare supplement insurance, prescription drugs, or general living expenses. For seniors living on fixed incomes, this creates a serious financial squeeze. Your biggest expense, healthcare, is rising much faster than your primary source of income. This isn't just a 2026 problem. It's a trend that's been happening for years, and it's one of the reasons why many retirees find themselves struggling financially despite receiving Social Security benefits. This brings us to what's happening behind the scenes in Washington, where lawmakers are scrambling to address Social Security's long-term survival. The numbers are stark. The Social Security Trust Fund is projected to face insolvency as early as 2033 if no action is taken. That's less than a decade away. But here's what might surprise you. Despite this looming deadline, there's virtually no appetite in Congress for a massive overhaul of Social Security. According to legislative aides, the most likely scenario is a series of small, targeted changes implemented over several years. Why? Because with over 70 million people receiving benefits each month, any attempt to make sweeping changes risks leaving vulnerable Americans without the support they desperately need. Instead, the focus is on what policymakers call incremental reform. They're focused on finding small adjustments that can be implemented quickly and with less political backlash.
These are smaller adjustments designed to improve the program's efficiency, reduce costs, and ensure benefits continue flowing to those who need them most. One major area of focus is eliminating fraud, waste, and abuse within the program. The Trump administration made it a priority to root out improper payments, including benefits going to deceased individuals or people who don't legally qualify. By cracking down on fraudulent and wasteful payments, they've been able to redirect billions of dollars back to the Social Security Trust Fund. It might not sound glamorous, but every dollar saved from fraud is a dollar that can go toward legitimate beneficiaries. The Social Security Administration is also using artificial intelligence and advanced data analytics to detect suspicious patterns and prevent fraud before it happens. This isn't just about saving money, it's about protecting the integrity of a program that millions of Americans depend on. But perhaps the most interesting development is what's happening with Medicare, because it could serve as a blueprint for Social Security reforms. The Centers for Medicare and Medicaid Services is currently running a pilot program in 6 states: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. These states didn't volunteer for this program. They were selected by federal designation to test strategies aimed at reducing wasteful healthcare spending. Here's the shocking part. According to CMS, up to 25% of healthcare spending in the United States is considered wasteful. In 2022 alone, an estimated $5.8 billion in Medicare spending went towards services with minimal clinical benefit. That's not a typo. Nearly $6 billion spent on healthcare that didn't actually help patients. The pilot program is testing ways to identify and eliminate this waste while maintaining quality care. If these Medicare reforms prove successful in reducing costs and improving outcomes, similar strategies could be applied to Social Security. The goal would be to eliminate unnecessary expenditures while focusing resources on people who have legitimately paid into the system throughout their working lives. This approach represents a fundamental shift in how policymakers think about entitlement reform. Instead of cutting benefits or raising taxes, they're focusing on making the programs more efficient and eliminating waste. It's a strategy that could potentially extend Social Security's solvency without causing undue harm to beneficiaries. But the challenge of reforming Social Security equitably cannot be overstated. Any change to a program this size and this important will have winners and losers. The key is ensuring that the most vulnerable Americans don't bear the brunt of necessary adjustments. That's why the incremental approach makes sense, even if it's not as dramatic or newsworthy as sweeping reform. Each small change can be carefully monitored and adjusted if it's causing unintended consequences. It's like steering a massive ship. You make small course corrections rather than trying to turn sharply and risk capsizing. So, what does all this mean for you as a current or future Social Security recipient? First, expect gradual, ongoing adjustments over the coming years. These will likely include further digitalization of services, continued efforts to reduce fraud and waste, and targeted adjustments to benefits and eligibility criteria. Second, don't expect a major overhaul anytime soon. While the need for reform is widely acknowledged, policymakers are committed to protecting the program's core promise while making it more sustainable. Most importantly, stay informed and prepared. As new policies are rolled out, be proactive about seeking information and understanding how changes might affect you. The Social Security Administration's website is your best resource for official information, and don't hesitate to contact them directly if you have questions about your specific situation. The future of Social Security will be shaped not just by policymakers in Washington, but by the voices and experiences of the people who depend on it. By staying engaged and informed, you can help ensure that this vital program continues to provide the security and peace of mind that millions of Americans have counted on for nearly 9 decades. If this breakdown helped you understand what's really happening with Social Security, hit that like button and subscribe to Financial Area for more insights that could impact your financial future. And let me know in the comments, are you prepared for these upcoming changes, or do you have concerns about how they might affect you? I read every comment, and your questions help shape future videos.